Can we turn back the clock on chronic kidney disease? Is it science fiction or a scientific possibility? This is not just a question, but a hope for many whose lives have been impacted by chronic kidney disease. I'm Diva, and welcome back to our channel. Today we are discussing a worldwide problem. Chronic kidney disease, or CKD, is an enigma that has puzzled medical science for decades. It's a condition that affects nearly 1 in 7 adults globally, a rather startling statistic. It's a stealthy disease, often showing no symptoms until it has advanced to a dangerous stage. Living with CKD can be a daily struggle. It's not just about managing the disease, it's about managing life around it. The constant medical appointments, the dietary restrictions, the fatigue, it all takes a toll, not just on the patient, but also on their loved ones. But what if we could change this narrative? What if we could turn the tables on CKD, and instead of just managing it, we could actually reverse it? That's a question that's been on the minds of medical researchers across the globe. The human body is an amazing machine, capable of healing and regenerating itself in ways we are only beginning to understand. And kidneys, despite their delicate nature and complex functions, are no exception. They have a remarkable ability to repair themselves under the right conditions. So is it conceivable that we could harness this regenerative power to reverse CKD, to not just halt its progression, but to actually restore kidney function? The idea may sound like a plot from a science fiction novel, but in the world of medical science, nothing is impossible. The journey to unravel the enigma of CKD is a long and winding one, but every step brings us closer to a potential breakthrough. So let's delve deeper into the question. Can we reverse chronic kidney disease? It's a question that carries the hopes of millions, and it's a question that we'll strive to answer. As we ponder on the possibility of reversing chronic kidney disease, it's essential to understand the lived experiences of those battling the disease. In this segment, we'll share a few personal stories that shed light on the daily realities of living with CKD. Everyday life with chronic kidney disease is a balancing act. It's about managing diet, medications, and lifestyle changes while trying to maintain a semblance of normality. For Jane, a 45-year-old teacher, the diagnosis came as a shock. She was always health conscious, but the silent nature of CKD meant she didn't realize something was wrong until a routine health checkup. She now has to maintain a strict diet, attend regular dialysis sessions, and deal with constant fatigue. But Jane is a fighter. She's adapted to her new lifestyle and is hopeful about the future. Then there's Robert, a 60-year-old retired firefighter, diagnosed with CKD due to his long-standing battle with diabetes. His days are filled with medical appointments and dialysis sessions. He misses his active lifestyle but is grateful for the support of his family. For Robert, CKD is a tough adversary, but one he is determined to fight. These stories, and countless others like them, underscore the urgent need for breakthroughs in CKD treatment. They remind us of the human faces behind the statistics and the importance of our quest to understand, manage, and ultimately reverse chronic kidney disease. As the music fades, we transition into the next scene, ready to delve deeper into the complexities of this disease. Before we can answer the question of reversal, we must first understand what chronic kidney disease is. Chronic kidney disease, often abbreviated as CKD, is a condition characterized by the gradual loss of kidney function over time. It's like a slow, stealthy thief that creeps in unnoticed, robbing the kidneys of their ability to do their job effectively. The kidneys, those two bean-shaped organs in your lower back, are your body's chemical factories. They perform a host of vital functions like filtering waste products from your blood, balancing your body's fluids, and releasing hormones that regulate blood pressure, make red blood cells, and maintain bone health. So what causes this stealthy thief, this chronic kidney disease? Well, the most common culprits are diabetes and high blood pressure, which are responsible for up to 2/3 of the cases. Other causes include inherited diseases like polycystic kidney disease, certain autoimmune conditions, and long-term use of certain medications. Symptoms of CKD are usually subtle and occur late in the disease. They include fatigue, lack of concentration, poor appetite, and trouble sleeping. As the disease progresses, the symptoms become more severe and can lead to swelling in the ankles, vomiting, weakness, shortness of breath, and even changes in skin color. Chronic kidney disease is classified into 5 stages, with stage 1 being the mildest and stage 5 being the most severe, also known as end-stage renal disease. The stages are determined by the kidney's glomerular filtration rate, a measure of how well the kidneys are filtering waste from the blood. It's important to remember that CKD is usually a progressive disease. This means that it tends to worsen over time even with treatment. However, the speed of progression can vary greatly from person to person. Some people may live with the disease for decades without it progressing to the end stage, while others may reach end-stage renal disease within a few years. Now that we understand the disease better, let's explore the current treatments available. Before we delve into the possibility of reversing chronic kidney disease, let's take a moment to discuss the importance of early detection. The stealthy nature of chronic kidney disease means that it often goes undetected until it has progressed to a severe stage. However, if caught early, the progression of the disease can be slowed and in some cases halted. This is why regular checkups and screening are so crucial, especially for those at higher risk, such as people with diabetes, high blood pressure, or a family history of kidney disease. Early detection involves tests that measure your blood pressure, check for protein in your urine, and calculate your glomerular filtration rate. If CKD is detected, lifestyle changes and medications can be implemented immediately to manage the disease and slow its progression. So, while we don't have a cure for chronic kidney disease yet, early detection and proactive management can significantly slow down its course and improve your quality of life. But what if we could do more than just slow it down? What if we could turn back the clock and reverse the damage done by CKD? Let's explore that next. Before we dive further into our discussion, we'd like to take a moment to remind you that your support matters to us. If you're finding this video helpful, don't forget to hit the like button and share it with your friends. By doing so, you're helping us raise awareness about chronic kidney disease and the importance of early detection. And if you want to stay informed about this critical topic and many others, make sure to subscribe to our channel. We regularly post informative videos that can help you and your loved ones stay healthy and informed. Don't forget to hit the notification bell as well, so you never miss out on our latest content. Your support fuels us to keep providing valuable information, and we deeply appreciate it. Now let's get back to our discussion on chronic kidney disease and the potential of reversing it. The treatments for chronic kidney disease aim to slow down the progression, but can they reverse it? At present, the treatment options for chronic kidney disease are designed to manage the condition and prevent further damage. The first line of defense is often lifestyle changes. This includes adopting a healthy diet that's low in sodium, potassium, and phosphorus. Regular exercise, maintaining a healthy weight, and quitting smoking can also help manage the disease. In addition to lifestyle changes, medications are often prescribed to control symptoms and slow the progression of the disease. These may include drugs to lower blood pressure, control blood glucose levels in diabetes, lower cholesterol levels, treat anemia, and prevent bone loss and fractures. When the kidneys are significantly damaged and can no longer function effectively, dialysis becomes necessary. This treatment mimics the function of the kidneys, removing waste and excess fluid from the blood. There are two main types of dialysis: hemodialysis, where blood is pumped out of your body to an artificial kidney machine and returned back to your body by tubes, and peritoneal dialysis, where the cleaning is done inside your body using the lining of your belly as a natural filter. In severe cases, when dialysis is no longer effective or appropriate, a kidney transplant may be the best option. This involves replacing the damaged kidney with a healthy one from a donor. Although a transplant is a major surgery with potential risks, it can offer a better quality of life than dialysis over the long term. However, it's important to note that while these treatments can control symptoms and slow the progression of the disease, they cannot cure chronic kidney disease. None of these treatments can reverse the damage that has already been done to the kidneys. While these treatments can manage the disease, they don't reverse it. But what if there was a way to turn back the clock? Between the current treatments and the potential for reversing the disease, there lies a vast landscape of possibilities, a bridge that connects the now with the what could be. This is where lifestyle changes and alternative therapies come into the picture. As we have seen, lifestyle changes play an important role in managing chronic kidney disease. But let's delve deeper. Could a radical transformation in lifestyle potentially slow down, halt, or even reverse the progression of the disease? Some researchers believe so. They argue that an aggressive approach to lifestyle changes, including a plant-based diet, regular exercise, stress management techniques, and the elimination of harmful habits like smoking and excessive alcohol consumption, could have a significant impact on the disease progression. And what about alternative therapies? Practices such as yoga, meditation, acupuncture, and herbal medicine are being explored for their potential benefits in managing chronic kidney disease. While these methods should not replace conventional treatments, they could serve as complementary therapies that enhance overall well-being and quality of life. For instance, mindfulness meditation might help manage the stress and anxiety associated with living with a chronic disease. Acupuncture could potentially help manage some of the symptoms of kidney disease, such as fatigue and sleep problems. And certain herbs and supplements could potentially support kidney health, although more research is needed in this area. It's important to note that any alternative therapies should be discussed with your healthcare provider to ensure they are safe and appropriate for your specific condition. So, while we await the scientific breakthrough that could reverse chronic kidney disease, there are steps we can take in the here and now to potentially slow its progression and improve our quality of life. Medical science is constantly evolving, so is reversing chronic kidney disease a part of that evolution? It's a question that sparks curiosity and hope, and the answer is, perhaps surprisingly, a tentative yes. The field of nephrology, which specializes in kidney care and treating diseases of the kidneys, is an area of medicine that is ripe with innovation and discovery. Our understanding of chronic kidney disease, its causes, and its progression is growing every day. In recent years, research has begun to explore the potential for reversing chronic kidney disease. While this concept may have once seemed like a distant dream, today it's a genuine area of scientific inquiry. Studies are being carried out into the regenerative capabilities of the kidney. One of the most exciting areas of research is stem cell therapy. The potential of these unique cells to repair and regenerate tissues is being tapped into, with some studies showing promising results. In one such study, scientists were able to slow the progression of chronic kidney disease and even reverse some of the damage. Another promising area of research is the use of drugs that can halt the disease's progression. While these drugs do not reverse the disease, they can prevent it from getting worse, providing patients with a better quality of life. It's important to note that these are early days. Most of these studies are still in their initial stages, and it will take time to determine their long-term efficacy and safety. However, the fact that we are even talking about the possibility of reversing chronic kidney disease is a testament to the incredible strides we have made in medical science. So, while we may not yet be able to reverse chronic kidney disease in the way we might like, the possibility is there. It's a flicker of light at the end of a long tunnel. And as the saying goes, where there's life, there's hope. While reversing chronic kidney disease is not yet a reality, the possibility does exist, and that's a reason for hope. Empowerment starts with knowledge. But what role does patient empowerment play in the management of chronic kidney disease? The path to better health often begins with understanding. When patients are equipped with knowledge about their condition, they are better positioned to make informed decisions about their treatment. This is particularly true for chronic illnesses like kidney disease. Patient empowerment is about more than just understanding the disease itself. It's about knowing your options, understanding your treatment plan, and being actively involved in your care. One aspect of patient empowerment is self-management. This involves learning skills to manage symptoms, treatment side effects, and lifestyle changes. It may also include learning how to monitor your own health and recognize when your condition may be worsening. Research shows that patients who are empowered to manage their own health often have better outcomes. They are more likely to follow their treatment plans, make healthier lifestyle choices, and have a higher quality of life. Another crucial aspect of patient empowerment is communication. Having open, honest conversations with your healthcare team can help you better understand your condition, your treatment options, and what you can do to improve your health. It can also help you feel more in control and less anxious about your condition. In the context of chronic kidney disease, patient empowerment can make a significant difference in managing the disease and potentially slowing its progression. It's about taking an active role in your health and not just being a passive recipient of care. When it comes to managing chronic kidney disease, patient empowerment plays a crucial role because at the end of the day, you are the most important member of your healthcare team. As we stand on the cusp of medical breakthroughs, what does the future hold for chronic kidney disease treatment? In the realm of medical science, the future is always brimming with possibilities. The same is true when we consider the future of chronic kidney disease treatment. In recent years, scientists and researchers have been tirelessly working, pushing boundaries, and exploring new frontiers to find innovative solutions for this debilitating condition. A major focus of this research is the development of novel drugs that can slow down the progression of chronic kidney disease. These drugs aim to target the underlying causes of kidney damage, such as high blood pressure, diabetes, and inflammation, thus providing a more comprehensive approach to treatment. Another promising area of research is the field of regenerative medicine. This involves using stem cells to repair and regenerate damaged kidney tissue. While this technology is still in its infancy, the initial results are encouraging, and it could potentially revolutionize the way we treat chronic kidney disease in the future. Furthermore, advances in biomedical engineering are driving progress in the development of artificial kidneys. These devices, which would mimic the natural functions of the kidney, could offer a life-saving alternative to dialysis or transplantation for those with end-stage kidney disease. Moreover, researchers are also exploring the potential of personalized medicine. By understanding the genetic and molecular basis of chronic kidney disease, we may be able to design treatments that are tailored to the individual patient's needs, thereby improving outcomes and reducing side effects. Despite these exciting developments, there is still much work to be done. Chronic kidney disease continues to be a global health challenge, affecting millions of people worldwide. But with each new discovery, we move one step closer to a future where chronic kidney disease can be effectively managed, or perhaps even reversed. The future of chronic kidney disease treatment may still be unwritten, but it is filled with hope. With continued research, dedication, and innovation, there is every reason to believe that we might one day overcome this disease. As we journey into the future of medicine, the possibility of reversing chronic kidney disease becomes more tangible. Until then, we continue to hope, research, and fight against this disease. This is Diva. Thanks for watching.